Hi, this is Russ Ward reporting for Pixels and Pills, and I have this afternoon with me at the FDA hearings John Kamp. John, please tell us about yourself.
Hi, I'm John Kamp. I'm Executive Director of the Coalition for Healthcare Communication. It's a group of advertising agencies and medical publishers who care a lot about what's going on here at this hearing.
I'm sure you do. So, John, tell us a little bit about your experience here so far.
I've been very pleased. I think the presentations by the people in the industry, particularly from the agency community, have been very good. But more important than that, what is the FDA going to do with this? We don't know, because FDA can't signal policy at this hearing and is being very poker-faced about that, because they should. They must be. It's the law, actually. But they're asking very good questions. And the questions that I think are making me most optimistic are questions that are probing the suggestions that many of us are making, that they need to open up the way in which they do things and think about it. They're asking questions about, well, what about these a pixel that might work that you could put with a banner ad that would enable people to find the FDA-regulated communication? They're following up on those questions, which means that at least there are some of them, at least, are open to some new ideas. And I think that's a good thing for FDA. But more important, we're talking about the public health. And what some of the things that are really very best here, I think, are the people that are encouraging the FDA to do what FDA can do best. And that is enable the companies to bring that FDA-regulated communications up on the internet so that people can find it. We hope so that they can understand it better, because it's pretty complicated stuff right now. But also we're recommending that they be very efficient at enforcing against internet scams. And we use, for example, in our testimony, the FDA website information about swine flu, where they said, these are scam activities, don't go there. They could be doing that in a whole additional range of things. We think particularly if they worked with FDA and other government enforcement activities, that they could be very effective in bringing down some of these scams. Now, are we ever going to catch all the scam artists? No. Actually, one of the FDA officials, when I was talking about it with her at an FDA meeting recently, said it's like whack-a-mole. I don't know if you've played whack-a-mole at the beach, but the more you beat them down, the more they come back up, right? So some of that's going to happen around scams, but I think if the FDA did some incredible enforcement, visible enforcement. Actually, I think that it was George Washington who said, a few well-placed hangings focuses the attention of the citizenry. A few well-placed hangings of some of the scam artists who, for example, I'm a diabetic. Every day I get emails suggesting that I could get off all of my medicines. I wouldn't have to take insulin anymore if I bought that product. Those people ought to be hung.
Well, I think you've certainly got the public's attention at this point, and I think it's well said that we really do need to pay close attention to this and be very serious about it. So, do you have one last statement before we let you go today?
Only that I'm optimistic that the FDA is open to new ideas, and it's going to be a good thing for FDA, but more importantly, it's going to be a good thing for the public health.
John Kamp, thank you very much for your time this afternoon, and we wish you well.
Thank you. I'm glad that you asked me.
This is Russ Ward reporting for Pixels and Pills at the FDA hearings.